Today's webinar is going to be about falls construction, and specifically some resources that we have available, as well as some insights that we have from surveillance data. My name is William Harris. I'm a research analyst with the data center at CPWR, the Center for Construction Research and Training. And I'm here today with my colleague, Rosa Greenberg, who is also a research analyst with our Research to Practice program at CPWR. So first, I'm going to get us started with an overview of what our presentation is going to look like today. We're going to start with an overview of who we are as an organization, CPWR. Then Rosa is going to tell us about some key findings from our fall experience survey, a survey that looked at the underlying causes of falls. Next, I'm going to share some information about the most recent data that we have available on trends in falls in construction. And next, Rosa will provide an overview of the national campaign to prevent falls in construction. After that, we're going to go over how to participate in this year's 2024 National Safety Stand Down to prevent falls in construction. And I'm also going to touch upon a couple more data center resources at that time too. So some context about who we are. CPWR, the Center for Construction Research and Training, is a nonprofit dedicated to reducing injuries, illnesses, and fatalities in the construction industry. Over the past 30 years, CPWR has planned, developed, and operated a National Center for Construction Safety and Health dedicated to these goals. Our programs are divided into the three branches that you see here on your screen: research, training, and service. Through these programs, we serve the industry nationwide by collaborating with key partners, including workers, contractors, health and safety professionals, researchers, key government agencies, unions, and other associations. But how do we work? These three areas, service, research, and training, all work together to help achieve our goals. I'll start with research. In 1990, CPWR began a series of cooperative agreements with NIOSH based on a competitive application process. And in 2019, we were awarded our 7th consecutive 5-year agreement to continue as the National Construction Center. Our current goal with this grant cycle is focused on research to practice assessment and adoption of best practices. From our beginnings, CPWR has led a consortium of experts at universities, government agencies, unions, and corporations to help address the issues and find solutions in the construction industry. Our current funding cycle, collaborating organizations in our research consortium include the University of California, San Francisco, University of Massachusetts Lowell, University of Washington, Virginia Tech, West Virginia University, and Washington University in St. Louis. Next, some context about our service. Our commitment to service runs through all of our work. To support our mission and complement our NIOSH-supported Construction Safety Health Research program, in 1996, CPWR launched the Building Trades National Medical Screening Program, or BTMed for short. BTMed, which serves former construction workers at U.S. Department of Energy nuclear sites, is now the largest medical examination program for older construction workers ever undertaken in the U.S. and is supported through funding from the Department of Energy. We also share our expertise with industry and government organizations to address continuing and emerging hazards. Finally, I'd like to share information about our training. In 1999, we began our hazardous waste safety and health and minority worker training programs with funding from the National Institute of Environmental Health Sciences, NIEHS. And after 9/11, we also added disaster response training. During this period, CPWR also became a partner as an OSHA-approved National Resource Center, or NRC, and then created a national training network on behalf of North America's building trades unions. Today, there are 12 international/national building trades unions in CPWR's NIEHS training consortium, and over 4,000 instructors qualified nationally to deliver OSHA training courses under CPWR's NRC umbrella. Taken together, tens of thousands of construction workers are trained annually in the U.S. by CPWR and its consortium partners. These three areas also work to serve our missions, which is to encourage the elimination or reduction of conditions constituting hazards, and to promote the maintenance and improvement of safe and healthy working conditions for workers in construction. Our mission is to publicize the results of our research findings, as well as to provide training resources and technical services to apply these research findings at the work site, and to direct research in defining and addressing issues of importance to workers. And lastly, We want to conduct research on a variety of topics of interest in the construction industry, including the psychological impact of work on workers, as well as analysis of corporate and government policies and consensus standards that affect the worksite. So I come from the data center at CPWR and am part of the research arm of our center. The data center represents a leading source of up-to-date statistics and information about the construction industry. We produce bi-monthly data bulletins that I'll cover later in the presentation. We create interactive data dashboards that help answer data questions and communicate key insights to our users. We also regularly publish peer-reviewed manuscripts on topics of interest in construction. And we also respond to data requests from stakeholders and other interested parties. If you have a data request or some data questions, feel free to email us at the datacenter@cpwr.com with any questions. And Rosa is here from our Research to Practice, or R2P program, which is also within the research arm of CPWR. R2P focuses on accelerating the widespread adoption of research findings and evidence-based solutions by employers and their employees to prevent occupational injuries and illnesses. They do this by synthesizing and translating research findings into practical resources to use on job sites and to raise awareness of hazards and prevent injuries and illnesses, in addition to developing and testing strategies to encourage their use. The R2P program conducts translational research and develops R2P tools. For example, the fall prevention and planning tools Rose will be talking about later in our presentation. R2P engages in translation activities by taking research that's conducted by CPWR, NIOSH, and other researchers and repackaging it into practical materials tailored for construction target audiences, most of which are available in both English and Spanish. They use a variety of mechanisms to share research findings and resources with target audiences, including websites, online planning tools and apps, social media, presentations, articles and reports, webinars, and podcasts. As the program has developed, they've moved from trying to find the singular best product and approach to finding a mix of products and approaches that reach the target audiences best. They've also established R2P-focused partnerships with influential groups to engage and motivate target audiences, particularly small contractors, to implement safety measures and inform future stakeholder-driven research. One example of their partnerships is that specifically relevant for their fall's work is the Roofing R2P Partnership. In the fall of 2014, the National Roofing Contractors Association, NRCA, and the United Union of Roofers and Waterproofers and Allied Workers, working with CPWR, established the Roofing R2P Partnership to work towards the shared goal of limiting job-related injuries and illnesses in the roofing industry. Together, this partnership has collaborated on a range of new resources, including the Safety Climate Assessment Tool for small contractors, the Safer Practices in Roofing video, and more. I'll now pass things over to Rosa to talk more about our Fall Experience Survey.
Thanks so much for that introduction and information, William. Hi, everybody. My name is Rosa Greenberg, and I am a research analyst at CPWR. And I'm really glad to be here today and excited to get to talk with you some about the key findings from our Fall Experience Survey. So the goal of this survey was to improve our understanding of underlying causes of falls from heights. And we plan to use that knowledge to inform ASSP and ANSI voluntary standards, create more targeted resources for the National Campaign to Prevent Falls in Construction, or the Falls Campaign, which I'll be talking about more later in this presentation, to inform our outreach and our education efforts, to influence future research on fall safety, and to share data like we're doing today. So CPWR developed the survey with support from the National Occupational Research Agenda Construction Sector Council Falls Work Group, ANSI 359 National Work at Heights Task Force, and other organizers of the Falls Campaign. And then analysis was co-authored by myself and my colleagues Grace Bartlett and Jessica Bunting. So the survey was available online for 3 months in early 2021, and it was voluntary and anonymous. We had English and Spanish versions, and participants were recruited to participate through email, through social media, through webinars, and through articles by CPWR and our partners. So after we collected the data, we did qualitative and quantitative analysis using Excel, Atlas TI, Qualtrics, and SAS. And something that is important to highlight about how the survey was structured before we jump into the results is that participants were asked to describe one specific fall incident that they had experienced or witnessed or investigated. And if they wanted to describe more than one fall incident, they could take the survey multiple times. But each survey participant was describing one specific fall. And that was the structure of the survey and explains some context for how our results are structured. So in terms of who we heard from, the majority of participants who responded worked in construction, but we also had respondents from people who were outside of construction. Within construction, the most common industry segment was the commercial segment, and that made up about half of our participants. The average participant had about 25 years of industry experience, and the most common role or position for participants for the survey was that of a contractor, safety and health representative. And for a more detailed breakdown of our participants, please see our full report. So we received 671 responses to the survey, and participants were not allowed to continue with the survey unless they had been involved in or witnessed or investigated a fall, which meant that 176 people were, or participants rather, were dropped from the survey at the start. And again, the survey was asking participants to think about one specific fall incident. So now I'm going to go through some of our key findings from our results, and the full report can be found in the link in the slides and on CPWR's website, and contains a lot more data and additional questions that you can explore for more detail. But today I'm going to be highlighting our key findings. So we asked several questions to help determine the severity of the fall, the most significant being whether the fall is fatal. So for context for the kinds of falls we heard about in this survey, more than a quarter of the falls that were described in this survey were fatal falls, 26.9%. In addition, 64% of the falls required assistance from emergency services, and almost 80% of the people who fell required medical care. So we asked about participants' perspectives on the primary causes of the fall, and the response that was selected most often was insufficient or ineffective planning. Following that was fall protection being provided but not used, and improper use of fall protection. Lack of relevant training was also highlighted as a major cause. We asked a series of questions about fall protection use, and nearly half of respondents said that the individual who fell was not using any fall protection at the time of the fall, 48.8% of participants, or falls rather. When fall protection was used, personal fall arrest systems were the top choice. So when asked whether the individual who fell believed fall protection was required by their employer, so this was asking about the beliefs of the person who experienced the fall, only 45% said yes, 38% said no, and 16% were not sure.
So shocked that it's still that high. 16.3 that people aren't even aware.
Well, absolutely. And it's part of what this question, is capturing, I think, is this is about asking whether the person who fell believed what the fall protection was required. So I think some of that 16.3% might reflect that a person was filling out the survey who wasn't the person who experienced the fall. So they weren't sure about the knowledge of the person who fell. So some of that, there's some of what you're seeing in that answer is kind of a reflection of both a strength and an issue in the survey methodology, which is that people could take the survey who were not the people who experienced the fall. And we have more information in the full report about the breakdown of company size for who was participating here.
Oh.
And it's, yes, we had a range. So next I'm going to be walking through our analyses that found significant associations. So we ran a lot of different tests to try to look at how these variables related to each other in terms of what the patterns were and what was significant about what people reported. And so the first thing to highlight is we looked at whether requiring fall protection was associated with an increased use of fall protection, and we found a quite strong relationship. So respondents who believed that fall protection was required by their employer were 8 times more likely to use it compared to those who did not believe it was required. So regarding training, the majority of those who fell had at least one type of training at the time of the incident. And the most common types of training were use of specific fall protection or arrest equipment being used at the time, OSHA 10, and training on proper use of access equipment. And while the majority had at least one type of training, around 31% of respondents said that there was no training or they weren't sure. So looking at fatal falls by type of training, there were a few types of training that were associated with fewer fatalities. For example, there were fewer fatalities among those who had self-rescue training. The odds of a fall being fatal were 76% lower for those who had self-rescue training compared to those who did not have this training. And when asked about the level of planning, respondents indicated that for the majority of the incidents, some level of planning had been done. And the most common type of planning was pre-job planning. But 34% said that no planning had been done or they were not sure. And our more in-depth analysis revealed that the odds of using fall protection were 71% lower for individuals whose employer or competent person did not do any planning, compared to those whose employer or competent person did plan or they weren't sure. And when asked whether the individual was working for a general or a subcontractor at the time of the fall, we found that those who were working for a subcontractor were at greater risk for fatal falls. When we looked at fatal falls by type of contractor, we found that individuals working for a subcontractor were 2.7 times more likely to die from the fall compared to those working for a general contractor. So I'd like to conclude this discussion of the fall experience survey by highlighting some of our key takeaways. First, more comprehensive planning for fall prevention is really needed. Respondents believe that the lack of adequate planning was a key underlying cause of falls. Lack of planning is associated with a lower likelihood of using fall protection, and the odds of using fall protection were 71% lower for individuals whose employer did not do any planning or they were not sure. Second, in nearly half of all falls described in this survey, no fall protection was being used. Third, employers should inform workers of and enforce company policies regarding fall protection. Employee beliefs were strongly associated with use of fall protection, and respondents who believed that fall protection was required were 8 times more likely to use it. Fourth, rescue training may help reduce fall-related deaths. The odds of a fall being fatal were 76% lower for those who had this type of training. And last, workers employed by subcontractors face an elevated risk of dying from falls. Individuals who worked for subcontractors compared with general contractors at the time of the fall incident were 2.7 times more likely to die. So that wraps up what I wanted to go over about the fall experience survey. And then next, William is going to tell us more about national data trends.
I'll be covering some additional data related to falls construction, and let me just give you a quick overview of what I'm going to be covering shortly. First, we're going to be starting with fatal falls in construction, looking at overall trends. Next, we're going to take a look at employment characteristics by industry, state, and establishment size, among others. Then we're going to look at some data related to injury characteristics, or some data specific to the types of falls, or rather when they happened, how high the fall was. Then I'm going to touch on a little bit of data that we have related to demographic characteristics of workers that died from these falls. Then I'm going to shift over to covering non-fatal falls. We'll cover some overall trends there, as well as some industry trends that we've observed. For all fatal fall data, that comes from the Census of Fatal Occupational Injuries, or otherwise known as CFOI, and represents a complete count of fatal occupational injuries. Comparatively, the non-fatal fall data comes from the Survey of Occupational Injuries and Illnesses, otherwise known as SOI, and only represents injuries among private wage and salary workers. Both of these data sets come from the U.S. Bureau of Labor Statistics, and we additionally use the current population survey in order to calculate rates that are seen in the following charts. So the first chart that I have here covers both fatal fall assistant trips, otherwise known as, abbreviated as FSTs throughout this presentation, as well as fatal falls to a lower level, or FTLL, in construction from 2011 to 2022. Some of the important takeaways from this chart are that fatal falls to a lower level accounted for over 96% of fatal falls, slips, and trips in construction from 2011 to 2022. Since 2011, both of these injury categories rose by 53%, while the rate of these injuries per 100,000 full-time equivalent workers rose by only 13%. So even though we see the number increasing dramatically, the increase in the rate isn't keeping a pace of that increase in the number, which means that we are potentially making some gains in worker health and safety as they relate to falls, even as we see these rates increasing. I'd also like to take this time to point out the year 2019 in this chart, in which there are 418 fatal falls, slips, and trips and 401 fatal falls to a lower level. This is one of the highest points that we've seen in the past 12 years for these falls, and is something that I want to keep in mind as we move on to some of the employment characteristics. So this chart covers falls, slips, and trips in construction by major construction subsector. As another note, this chart, alongside others in this presentation, utilize data on falls, slips, and trips when similar publicly available data on falls to a lower level is missing. However, because as we've shown, about 96% of these injuries in construction are due to falls to a lower level, one of our primary injuries of interest, we can still use this information as a proxy to talk about these falls from height. This chart specifically shows us that specialty trade contractors accounted for 69% of fatal falls, slips, and trips from 2011 to 2022. While the number of fatal falls, slips, and trips in construction of buildings doubled over this period from 54 to 108 in 2022. So let's also look now at 2019, that year that I pointed out before. When comparing it to the prior year, we can see that a majority of the increase going from that year to the next was driven by fatal falls in specialty trade contractors. When we are able to break down injuries in this way, either looking at major subsector or, as we do later in this presentation, looking by a variety of different measures, we're able to better understand some of these overall national trends that usually we might have questions about. And that also can help us guide specific intervention or policy that helps address these issues. Next, we looked a little bit deeper, and we examined the detailed subsectors that had the highest number of fatal falls, slips, and trips in 2022. For that year, roofing contractors accounted for the largest number of fatal falls, slips, and trips, representing almost 1 in 4 of those fatal injuries that we saw in that year. This was then followed by workers in residential building construction, who were the second highest, with 63 fatal injuries, representing 15% of fatal falls, slips, and trips that year. This chart highlights information that we already know, which is that roofing contractors are uniquely at risk to the dangers presented by falls from height. However, when we have the opportunity to examine injuries in this way, we can start to examine their impact over time, as well as develop more targeted interventions to apply to particular parts of our industry. When we looked at fatal falls, slips, and trips by state, we can see that in 2022, there were 2 states that had the highest number of fatal injuries, those 2 states being Florida and Texas, with 46 fatal falls, slips, and trips for that year. However, when we look at the rates of these fatal injuries, we can see that Florida had a rate 1.4 times higher than the national average for 2022. It's important that when we look at data by state, that we also examine these injury rates in order to reveal areas that don't meet what we might expect given the data. For example, Louisiana. There were 12 fatal falls, slips, and trips in Louisiana in 2022, yet the rate of injuries was 2 times higher than that for the entire nation. So when we're looking at this chart, it's important to see these orange bars on the right. Each one of those dark orange bars represents a state that had a rate of fatal falls, slips, and trips higher than the national average. And each one of those states represents a place that potentially more work could be done to to prevent falls and protect workers. So one of the important things that we were able to look at with this most recent set of data was establishment size, especially in how it relates to worker safety and health. This chart was produced using restricted access CFOI data in order to examine the impact of establishment size and fatal fall rates from 2011 to 2022. And what we found was that small establishments with 1 to 10 employees accounted for over 70% of fatal falls from 2011 to 2022. When looking at all fatal injuries, these small establishments accounted for 57% of all fatal injuries. This data highlights that we need continued efforts to reach small contractors and communicate best safety practices, especially as they relate to falls. In the data center, we plan to continue to examine fatal falls among small contractors to answer more questions that we have about these workers. Next, we also looked at fatal falls by contractor status. This also being produced with our restricted access CFOI data. As Rosa already touched upon, subcontractors in the fall experience survey were more vulnerable to fatal falls compared to others. Though here our definition of contracted worker is slightly different than what you may expect. This status indicates if a worker was employed by a firm which was working under another firm that has overall responsibility for the operations at the work site. So while there is some overlap in those definitions, I do want to caution that they don't always match up one-to-one. However, that being said, we did see that in 2011 to 2022, contracted workers did represent almost 2/3 of all fatal fall injuries and represented over half of fatal injuries in construction. Next, we began to look at injury characteristics of these fatal falls. Due to data limitations, this data was only available for 2011 through 2018. But during that time, we did find that over 1 in 3 fatal falls to a lower level were from a height of 15 feet or less. When we examine falls by the height of a fall, it represents an important piece of data that can help inform us as standards on the use of fall protection get developed, especially as they revolve around minimum height requirements for their use. Using the restricted access CFOI data, we also had the opportunity to look at the time of day that falls occurred. We organized these injuries into 4 time groups, as you can see in the chart: 6 a.m. to 9:59, 10 a.m. to 12:59, 1 p.m. to 5:59 p.m., and then 6 p.m. to 5:59 a.m. And then what we did was we calculated an hourly average based off of the number of included hours for each time period. And what we found was that the time period that had the highest hourly average of fatal falls from 2011 to 2022 consistently was 10 a.m. to 12:59 p.m., so around that lunch hour. And using that information, we can help understand not just, where are these falls happening by state, where these falls are happening by contractor status, but also what time of the day. Are there riskier times of day? And I think this chart shows that that time of day is the riskiest for construction workers. Next, we also have some information for fatal falls by demographics. So using some historical data, back in 2017, we still had access to the data to produce these estimates that showed that in 2017, 39% of fatal falls to a lower level construction were among Hispanic workers. Due to changes in data access and data agreements, we're no longer able to get those numbers, which is a shame as it represents a lack of access to what I feel is rather important data. Similarly, when we try to look at fatal falls by gender, we also have some data limitations, as we can't examine falls by gender in construction itself. However, we can show the following, which is that on average from 2011 to 2022, there are 12 annual occupational fatalities among women in construction. And notably, in 2017, there was at least one recorded fatal fall to a lower level of a woman in construction. When we look at all industries, we can see from 2011 to 2022 that women accounted for about 2% of all fatal falls to a lower level. And additionally, in all industries, when we look at the proportion of fatal falls to a lower level among fall slips and trips, we can see that they accounted for 30% of fall slips and trips among women. Comparatively, when we looked at this number among all workers, that proportion was 81%. Next, we're going to look at some information on non-fatal falls. This data is going to look a little bit different due to changes in SOI data moving to a biennial publication, so once every 2 years. As a result, we've collapsed historical data into these 2-year time bins to aid in the comparability. Having done that, we can see that from 2011-2012 to 2021-2022, there was a 13% increase in non-fatal fall slips and trips and a 2% increase in non-fatal falls to a lower level. However, both injury types saw substantial decreases in the rate of their injuries, especially notable for non-fatal falls to a lower level, which saw a 25% decrease in the number of injuries, in the rate of these injuries. Unlike with fatal fall slips and trips, however, falls to a lower level only accounted for 44% of non-fatal fall slips and trips in 2021-2022. So much like with our fatal injury data, we can see that specialty trade contractors accounted for 70% of non-fatal falls to a lower level. And here too in this chart, we can see how the makeup of these injuries can change from year to year by major subsector. And it represents another way that we can examine, especially non-fatal falls, as we see improvements or increases from year to year. And with that information, I'll wrap up my portion of the data, and I'll go ahead and pass things back over to my colleague Rosa in order to tell you more about our Falls campaign.
Thanks so much, William. So the Falls campaign seeks to prevent falls in the construction industry. As we've talked about today, and as everybody on this call knows deeply, falls are the leading cause of death in construction, and every fall is preventable. The campaign is led by the National Occupational Research Agenda Construction Sector Council, and its campaign leaders are NIOSH, OSHA, and CPWR. It is an evidence-based campaign that depends on ongoing evaluation. And it was launched in 2012. The campaign name is Safety Pays, Falls Cost. And you can find the campaign website at stopconstructionfalls.com. The campaign is focused on 3 key priorities: planning to prevent falls, providing the right equipment, and training everyone on how to use that equipment safely. So campaign implementation has included the development of a wide range of falls resources, and all our resources are compiled on our website. In 2014, the campaign founded the National Safety Stand Down to Prevent Falls in Construction, an event that many of you may already annually promote, host, or participate in. And our next stand down is coming up in May, which I'll be talking more about how to participate in a moment. In 2024, we redesigned and relaunched stopconstructionfalls.com, and here it is. This is our repository for practical tools for preventing falls, and information about fall injury and fatality surveillance data, like William just presented, along with other types of research. So we redesigned the page, which previously had been up since 2012. So we were overdue for a new look to make it more user-friendly and more engaging. And so as you'll see, as you use the page, we have incorporated a lot more preview images, clearer menu pathways, an improved search function, and more engaging design. One important element of the homepage that I want to highlight is that we've enabled Google Translate, and we've designed the page with automated translation in mind. Users can switch between English and Spanish on a menu that pops up on the upper left hand of the site. And we designed our menu titles and page titles with these automated translations to make sure that the page is usable and is friendly for monolingual Spanish-speaking users. So one example of what this looked like, our stand down resources page used to be titled the One Stop Stand Down Shop. And with Google Translate, this translated literally to unique window into the stand down, which does not make a lot of sense. So we reviewed and we retitled all of our menus, our page titles, and our search terms with that in mind. And another thing to highlight is that we've also designed with accessibility in mind. We used a color contrast check software to make sure our color combinations are accessible for people with visual impairments. And we've added an accessibility plugin to allow you to toggle the font size, use grayscale, and other components for accessibility. So our page includes a wide range of resources, but I specifically want to highlight our Spanish language resources because in 2017, the most recent year in which we have this level of demographic data available from the Bureau of Labor Statistics, the rate of Hispanic workers who died from falling to a lower level was 50% higher than their non-Hispanic counterparts. And this is an occupational health inequity. It's important to provide training materials in the languages workers use, and you can access many materials on our page. So the way that the page is structured with the redesign is if they're available in English and Spanish, both links are listed in each topic and area section. And then we also have a dedicated page linked in the slides that aggregates all of our Spanish language resources. So Well Stop Construction Falls uses Google Translate for the body of our webpage. Any material that we're linking to that's in a PDF has been professionally translated and is not an automated translation. The Falls campaign has also expanded to provide resources in additional languages beyond English and Spanish. We've translated and reproduced popular infographics in 7 new languages: in Arabic, Haitian Creole, Japanese, Polish, Portuguese, Russian, and traditional Chinese. So with that, I'm going to turn things back to William to tell us some about resources from the data center and then wrap up with the stand down.
So some of the data center resources that we have available are via our data bulletins, which are published 6 times a year, bi-monthly, once every 2 months. Each one covers an important topic in the industry in a pretty concise and focused document, usually no longer than 5 or 6 pages. Most recently, we covered falls in our March 2024 data bulletin, for which a lot of the research that I've shown here was performed for. And our next data bulletin is going to be coming out in the start of May 2024, and it's going to cover trenching injuries in construction. One of our other major resources is the Construction Chart Book, which was last published in 2018. We're currently developing the update for that, which is going to be moving it to an interactive format as well as a traditional PDF format. And when I say interactive format, that's going to be similar to our third product, which are our interactive data dashboards. So as of yesterday, we had 31 active dashboards. And these dashboards are essentially interactive web pages that allow you to explore the data for yourself and look specifically at what kind of questions you're interested in answering. And the way that they do this is through the use of filters. So for example, this one that's shown is our construction fatality map dashboard, which recently got updated this past week. And it allows you to look at injuries by the injury type, by the state that they occurred in, by which year they occurred in, as well as having a map that provides some detailed fatality narratives. And so you can access all of these resources and more from our data center link, which was on the previous slide. And some of the other dashboards that we have that may be of interest are a dashboard specifically related to fall, slips, and trips in construction. We have an employment of Hispanic workers in construction dashboard, as well as a women in construction dashboard. You can find these all on CPWR's page, as well as our data center page. With that, I'm going to go ahead and pass things back over to Rosa to cover the stand down.
So this year, the stand down is going to be held from May 6th through May 10th. And it is our 1-week nationwide event organized by OSHA, NIOSH, and CPWR to raise awareness of slip, trip, and fall hazards and to prevent fall injuries and fatalities. So stand downs are voluntary events for employers to talk directly with employees about safety and to take action to prevent falls. It's an opportunity to distribute educational materials, train workers, discuss your company's safety policies and goals, and more. Any workplace event that focuses on fall hazards and reinforcing the importance of fall prevention and protection can qualify as a stand down. So OSHA maintains a database of free stand-down events that are open to the public. So you can check out that link to submit your event if you have an event that meets those parameters, and also look around to find events in your area or virtual events you can attend from anywhere. So there are so many ways to participate in the stand down, and I'm going to briefly go over some ideas for ways you could structure your event, but please use the link on this slide to find the guide that has links out for each of the resources or events I'm about to discuss. First, you could create or improve your written fall protection and rescue plan, and you can use our planning resources, including a detailed plan, a starter plan, a daily job site checklist, a tip sheet for rescue planning, and more. Second, you can attend virtual or in-person stand-down events, and OSHA's stand-down page is a great resource for that. Third, you could take it as an opportunity to step back to expand resources in languages other than English. Fourth, you can inspect equipment and revisit job hazard analyses, and use the week as an opportunity to inspect all access equipment in PPE, tag and remove anything that's damaged or broken, and review and reinforce company expectations for daily pre-shift safety checks. Make sure workers know company policies for inspecting, tagging, and removing equipment, and confirm that managers are providing sufficient time and training for workers to be able to do this every day. You can also revisit your job hazard analyses or other safety check procedures using CPWR's pre-task planning assessment checklist. And to ensure, and in addition, ensure a competent person has identified potential hazards and their solutions. Fifth, if you only have time for a short conversation, you can watch or listen to short videos and podcasts with your crew on Stop Construction Falls' website, and then engage folks in a discussion about how the information can be applied. Sixth, you can take time to discuss fall experiences and the consequences of falls. Personal testimonials are sometimes the most powerful way to communicate the serious consequences of falls. Seventh, you can conduct a toolbox talk. CPWR has a variety of free toolbox talks in English and Spanish to help guide training, reinforcement, and discussion, and it's all on stopconstructionfalls.com. Eighth, you can dedicate time to ask employees for their recommendations on how to improve fall prevention. This can be through an informal conversation or through a formal survey. Employees are the experts on their jobs. They might have new ideas for how to improve planning or rescue or other practices, or have safety concerns to bring to your attention that you might be unaware of. And engaging and empowering them promotes good safety leadership. Last, you could conduct a fall protection equipment demonstration. Many fall protection companies are willing to provide equipment demonstrations and visit job sites. So our online ordering form is open now to order free hard hat stickers and free hazard alert cards. Resources are first come, first serve. So please submit your orders ASAP for the stand down if you haven't submitted your order yet. And you can also order hazard alert cards through our year-round form outside of the spring window when the specific ordering form is open for the stand down. Hazard alerts are short, image-driven materials that deliver simple and direct messages for protection against safety and health hazards in construction. And they're available as printed cards, folded to pocket size, or as one-page PDFs. And they are free and always available from us. So please order them and use them. So if you do host a stand down or participate in a stand down, please register for a certificate of participation. You can get your certificate in English or in Spanish or both. And the certificate is also tailored to recognize how many years you've participated in the stand down. And so I know the images on this slide, which is our last slide, we're almost done, are from 2023. But the 2024 certificate is going to be available soon and accessible on OSHA's page. Registering for the certificate means your participation is counted in our annual evaluation of the event. And it also gives you an opportunity to provide any recommendations about how you'd like to see the event improve, and tell us what you did in your event. And I'm the person who performs this annual evaluation. I've been doing it every year for the last 4 years. And I promise I read every word submitted, and it's really, really valuable to hear about what happened in your event and also what you recommend change in how the event is coordinated. So please fill out the certificate form and tell us what you think and how we can improve.